Okay, for more on this, let's bring in CBS News medical consultant, Dr. David Agus. Good to see you, doctor.
Morning, Vlad.
So, what is the significance of this particular case in California?
It's a big milestone in this virus in that this case, the person hadn't been to China and there was no known contact with any carriers. That being said, there had to have been some contact. So what that means is, this hospital had a patient who come in who had difficulty breathing, transfer from another hospital on a ventilator, and it didn't meet the CDC criteria for testing. Yet the heroic doctors went ahead and tested, and what do you know, the patient was positive. This can't be the first case. So there are clearly other cases around the country. By chance, they tested this one. And what it means is the virus is spreading in the United States today, and we're going to see a significant increase in the number of cases over the next several days. Right now, there are only several states that actually have the ability to do the testing. We're not prepared to do the testing across the board in the United States.
So let's talk about the coronavirus and symptoms. As people get more and more concerned about this, what are the symptoms? How would you know if you have it? Because I know that there are some people who have it and they are not showing any symptoms.
This is everyone says, well, David, there's so few people who have died. Why are you concerned about it? Why is everybody talking about it? Why is it in the headlines? It's because of exactly that point, is that for 2 weeks, people may not have any symptoms at all. And during those 2 weeks, they can spread the virus. So without even knowing you have it, you can spread it. Many people have mild symptoms and they're done, or no symptoms at all, and they can be done with the virus. Others can have significant symptoms. The elderly, we worry about. Smokers have more symptoms than non-smokers, at least in China. But the problem is that many people with the virus don't know they have it, and unintentionally, they can go to a mall, they can go to a movie theater, and that's where we get the exponential spread we're worried about.
If you do get the coronavirus, how likely are you to survive it?
Depends where you are in the world.
Let's say here in the U.S.
So if you're in the U.S., the estimates are that the death rate is going to be way less than 1%. We do have effective drugs that work against it. They're not been validated, so the clinical trials aren't complete, but they look like they're effective. We have excellent supportive care here in the United States. So just like with influenza, where the death rate is significantly below 1%, I would think that corona is going to come in around the same. The problem is just how quickly and big it'll spread. There's an estimate from a group at Harvard that 40 to 70% of the entire world's population will be positive at some point for coronavirus. That's a hell of a number.
I thought it was surprising when the President of the United States yesterday during his press briefing said that he was surprised and shocked to learn from Dr. Fauci that the flu kills between 25,000 and 69,000 people in this country alone. Now, I don't cover infectious diseases, and I'm not a doctor, so when you hear numbers like that, which you and I have discussed in the past, it might be surprising to some Americans. Here's the President of the United States saying, yeah, I'm pretty surprised too. But when we had Fran Townsend on CBS This Morning today, she said that the mortality rate for the flu, or the common flu, is something like 1%, 0.1%. And it's really bad, it's 0.2%. But you were saying if we potentially could see here in the United States the coronavirus reach a level of mortality rate of 1%, which is a huge difference.
Well, no, I didn't say that. So Fran Townsend this morning said that the death rate of corona was about 2%.
Right.
That's not correct, unfortunately.
Okay.
So in China, they're only testing people who are really sick. And so when you look at a death rate where you're not counting most people who have the virus, the death rate is obviously going to be artificially much higher.
Got it.
So when you really test everybody, and again, a lot of people are asymptomatic, so they're not being tested.
Right.
That death rate is going to fall to, I would think it's going to be in the 0.2, 0.3, 0.4% at most.
Got it.
It's kind of like that movie Casablanca, where the chief of police walks in and goes, "I'm shocked. There's gambling going on here." Yes, we're all shocked that the death rate every year from influenza, from the flu, is 40 to 60,000 people. But that's the way it is. And that's why getting a flu vaccine, and again, a flu vaccine will not tell doctors that you have coronavirus if you get sick.
Right.
Unfortunately, that was said this morning. That's not correct. Getting the flu vaccine is important for flu. We don't yet have a vaccine for corona. I'm not sure.
And it could take about a year, right?
If at all. Remember, 34% of common colds are coronavirus. And we've been trying to make a vaccine for the common cold. I haven't seen one yet. So we may not make one at all. So if we have one, it could take a year, but there's a big if there.
New York City we all live in very close quarters here. In some parts of the country, people are more spread out, so the risks or the concerns are not the same. Here in New York City, what are some of the things that people can do? We're traveling in subways, we're in supermarkets and tightly contained spaces, washing hands. What would you advise people to do as part of their daily routine? You
know, we've had 2 cities in the United States, San Francisco and Orange County, announce that it's an emergency, even though there weren't cases in those areas. And I think what you're going to see is a new normal. We're going to see quarantines in this country over the next several weeks. Our way of life will change. We're not going to see crazy death rates, so we're all going to be safe. There's no reason for panic, but everybody, I think, across the country should start having dried foods in their house, just in case. I think you should make a plan as a company to work from home. So tell your employees, listen, I don't want our company to go down the drain. I want us to be productive. Here's what we're going to work from home if there's a quarantine. Be prepared if your school is closed, your children's school is closed, what to do with your children. In New York City, you're going to avoid crowded places. You're probably not going to go on the subway during those periods. And if there's a quarantine, you probably won't leave your apartment, so that's why you want the food there. This is going to be a changing time over the next, month to 2 months in our country, and we're going to see things that we've heard about and read about elsewhere. They've done it in Italy, they did it in China, and we're going to have it here, I predict.
How long, this is a very specific question, but how long, when you're washing your hands, how long should you wash your hands with soap? I'm already a big hand washer guy. I was actually surprised to read a statistic a couple of weeks ago that people inadvertently or subconsciously touch their face like thousands of times throughout the course of the day. So I'm trying to avoid that, but I wear contacts, so I'm always washing my hands. But how long should you actually keep your hands under the faucet?
So,
does it matter?
2 minutes and with soap is what the recommendations are. We haven't done studies of 90 seconds versus 120 seconds. The bottom line is you want to wash them very well.
Okay.
And one of the dominant means of any contamination of spreading viruses and bacteria is through the hands. And so if you're at a hospital, make sure the doctor or the nurse wash their hands with a disinfectant as soon as they walk in the room. When you're going to see a friend and you've been outside and in the subway, et cetera, wash your hands before you shake their hands. We all need to use common courtesy and protect not just ourselves, but each other.
Okay. Great advice. Doc, thanks as always. We appreciate it. Really illuminating. Thank you very much, Dr. Agus.